A major manufacturing plant that makes hospital IV fluids and dialysis solution had to temporarily shut down production after its facility in western North Carolina was damaged during the storm.
Baxter is a top supplier in the country. With its production halted, will it impact what is on hospital shelves? Fox 8's Celeste Smith has been checking in with a number of healthcare systems here in the Triad. So Celeste, what did you find out?
Many of the healthcare systems that I reached out to said that they're looking for alternative substitutions and suppliers. But for some of the people who depend on fluids like this, they said it's concerning.
That's kind of concerning because I use up quite a bit every night in my treatment for my kidneys.
Patrick Rizzo needs peritoneal dialysis 7 days a week. He uses Baxter's dialysis solution, 11 liters of fluid every night. Dialysis is a treatment for people whose kidneys are failing. Rizzo was set to get a shipment this week, but learned at a routine checkup it had been canceled.
I had to go in and talk to a nurse about routine maintenance. And they said, "Oh, have you received any of your product yet?" I said, "No, I haven't." And they said, let's look it up. And sure enough, I had been canceled.
He was instructed to place another order and that it would come in small batches. He got a call from Baxter saying that order had been canceled too.
I have about 2 weeks worth of product in my house. So within 2 weeks, once I'm done with all my product, I have no idea what to do next.
We reached out to several healthcare systems and dialysis centers in the Triad, which say they are monitoring the situation. Novant Health said Novant Health has been notified that we will not receive our full allocation of Baxter products, so we are working to source products from alternative suppliers. Cone Health said, like hospitals across the country, Cone Health is taking steps to conserve use of IV fluids. These steps include finding substitutes where available and having patients take medications orally when possible. And a statement from Fresenius Medical Care says, in part, we can confirm to date there has been no impact on patient care and treatment at our Fresenius Kidney Care dialysis centers.
There's a lot of people out there that, like myself, who need the product to survive.
In a press release from Baxter, it says the company has resumed shipment to hospitals and dialysis patients after the temporary hold last week. They have moved finished goods from its North Cove site that were not impacted by the storm and are inspecting other finished goods on site. At this time, with no shipment in sight, Rizzo is unsure of what to do once his supply runs low.
If they didn't get their product up and going, how many other people will pass away? There's a big ripple effect.
In a statement released yesterday, Baxter said that it will communicate any adjustments to allocations directly to providers. But as for Rizzo, he said that he still has not yet received an update on when he might get a potential shipment of his dialysis solution. Live in Jamestown, Celeste Smith, Fox 8 News.